You're standing in the supplement aisle. There are 47 bottles in front of you that all say turmeric. They range from $8 to $45. The labels are crowded with words you don't recognize: proprietary blend, standardized extract, full spectrum, made in a GMP certified facility. The bottle on the left says 950 milligrams. The bottle on the right says 500 milligrams. Logic says go with the higher number, right? Wrong. That's exactly the kind of mistake the supplement industry is counting on you to make. Today, I'm going to show you exactly how a pharmacist reads a supplement label. The 7 red flags that immediately tell you a product is overpriced, ineffective, or potentially dangerous. The 4 pieces of information that actually matter, and they're rarely on the front of the bottle.
The 3 certifications worth paying more for, and the dozens of meaningless labels you can safely ignore, and the wallet card framework you can take to any store, anytime, and use to make the right decision in under 60 seconds. By the end of this video, you'll never overpay for a useless supplement again. And more importantly, you'll know how to spot the products that could actually hurt you. Let me start with why this matters more for seniors than anyone else. Adults over 60 take more supplements than any other age group. The average senior in the United States takes 4 or more daily supplements. Total spending on supplements by Americans over 60 exceeds $20 billion per year. And the supplement industry knows exactly who its biggest customer is. Marketing is specifically designed to appeal to older adults. Claims about energy, joint health, memory, immunity, sleep. Most of those products will not cause direct harm. But many will fail to deliver what the label promises. Many will be priced 2 to 5 times higher than equivalent products. And some, particularly those with proprietary blends and undisclosed ingredient sources, can cause real harm, especially when combined with the average senior's 5 to 7 prescription medications. The financial cost over a year of unnecessary or ineffective supplements averages between $300 and $2,000 per senior. That's money that could go toward proven nutrition, quality footwear, a fall prevention assessment, or whatever else matters to your health. So learning to read these labels properly isn't a small skill. It's one of the most practical financial and health decisions you can make. Quick pause. If you've ever felt overwhelmed in the supplement aisle and just grabbed whatever looked reputable, you're in the majority. The supplement industry is not designed to be easy to navigate. The packaging is intentionally confusing, the regulations are weaker than for medications, and the marketing language exploits exactly the gaps in regulation. The next 40 minutes will give you the tools to cut through all of that. Stay with me. Before we get to the 7 red flags, I need to give you a 5-minute crash course in how the supplement industry is actually regulated, because if you understand that, the red flags will make far more sense. In the United States, supplements are regulated under a law called the Dietary Supplement Health and Education Act of 1994, DSHEA for short. This law specifically classified vitamins, minerals, herbs, and other dietary substances as foods, not drugs. The implications are huge. Unlike prescription medications, supplements do not require FDA approval before they go on the market. Manufacturers do not have to prove the product is safe before selling it. They do not have to prove it's effective. They do not have to prove that the bottle actually contains what the label says. The FDA's authority is limited to taking action after a product has already caused harm and been reported. In the UK and EU, regulation is somewhat stricter through the European Food Safety Authority and the Medicines and Healthcare Products Regulatory Agency, but the same fundamental gap exists. Manufacturers are largely operating on the honor system. This has been confirmed repeatedly by independent testing. A 2015 New York Attorney General investigation tested popular herbal supplements sold at major retailers: GNC, Walgreens, Walmart, Target. They found that 4 out of 5 products tested did not contain the herbs listed on the label. Many contained cheap fillers like rice powder, asparagus, or houseplants in place of the advertised herb. A 2013 study published in BMC Medicine analyzed 44 herbal products and found that roughly 1/3 contained ingredients not listed on the label or contained substitution of cheaper plants for the advertised herb. A 2017 analysis of bodybuilding and weight loss supplements found that nearly half contained undisclosed pharmaceutical ingredients, including banned drugs. This is the regulatory reality. Most supplements you'll see in mainstream stores are made by reputable companies and do contain what they claim. But there is no automatic guarantee. You have to look for it. And the way to look for it is the 7 red flags and 3 certifications I'm about to teach you. Pattern interrupt. I want to be very clear about something. I'm not anti-supplement. There are supplements with strong evidence. Magnesium glycinate for sleep, aged garlic for blood pressure, omega-3 for inflammation, vitamin D for bone health, and many others. The supplement industry contains both genuinely useful products and outright scams. The skill is being able to tell the difference. That's what we're building right now. Stay with me. Let's start with red flag number 1, proprietary blends. This is the single most important warning sign on any supplement label. A proprietary blend is a listing of multiple ingredients combined under a single brand name term, with only the total weight of the blend disclosed, not the amount of each individual ingredient. For example, a label might list Joint Support Proprietary Blend, 1,500 milligrams, and then list 10 ingredients underneath. You have no idea how much of each ingredient is actually in there. The manufacturer can put 1,499 milligrams of the cheapest ingredient and 1 milligram of every other ingredient, and the label is technically accurate. Proprietary blends exist for one reason: to hide cheap formulations behind impressive-looking ingredient lists. There is no scientific justification for them. They are a marketing strategy. If a manufacturer hides individual doses behind a proprietary blend, assume it's because the doses do not match the research. The fix is simple. Look for supplements where each active ingredient is listed individually with its own milligram amount. If you see proprietary blend or specialty matrix or any similar term, put the bottle back. There is almost always a transparent competitor at a similar price. Red flag number 2, meaningless certification badges. Supplement labels are covered in badges and seals. Most of them mean nothing. Here are the badges to ignore. GMP certified. Good manufacturing practices is required by law. Putting it on the label is like a restaurant advertising that it complies with health codes. It's the minimum standard. Natural has no regulated definition. Anything can be labeled natural. Pharmaceutical grade has no regulated definition for supplements. Pharmaceutical grade applies to medications, not supplements. Doctor formulated or doctor recommended could mean any doctor, anywhere, ever. There's no regulatory requirement for this phrase. Clinically proven, this requires you to ask, proven for what, by whom, in what study? Often the actual clinical evidence is for one ingredient at a different dose than what's in the product. Lab tested? Every supplement is lab tested by the manufacturer. The question is whether it was independently tested by a credible third party. The 3 certifications that do matter, and these are what you want to see on the label, are USP verified, NSF certified, and Consumer Lab approved. USP, that's United States Pharmacopeia, is a nonprofit organization that independently tests supplements for identity, potency, purity, and dissolution. If a product carries the USP verified mark, you know the bottle contains what it claims, free of contaminants, and the contents will dissolve properly to be absorbed. NSF International offers similar third-party testing, and their NSF Certified for Sport mark also confirms freedom from banned substances. Consumer Lab is a subscription-based testing service that publishes results. Products that pass and choose to display the Consumer Lab seal have been independently verified. These 3 certifications cost manufacturers real money to obtain, so cheaper brands often skip them. Paying a few dollars more for a USP or NSF certified product is usually worth it. Red flag number 3, outrageous health claims. Federal law prohibits supplements from claiming to cure, treat, or prevent disease. But manufacturers use carefully worded phrases that imply medical benefits while staying technically legal. Watch for phrases like supports healthy. This is the legal substitute for treats. Promotes. This is the legal substitute for improves, may help maintain, vague enough to be meaningless. Then there are the outright illegal claims, often found on smaller or imported brands. Reverses diabetes, cures arthritis, eliminates dementia symptoms, replaces blood pressure medication. Any product making these claims is either illegally marketed or operating in a regulatory gap. Either way, stay away. The bigger the claim, the smaller the actual evidence. Legitimate supplements with real research behind them are typically marketed conservatively because exaggerated claims attract regulatory attention. The bold claim is itself a warning sign. Red flag number 4, the active ingredient is buried or vague. When you pick up a supplement, the front of the bottle might say premium joint formula in large letters. The back will list the active ingredients in small print. What you need to do is verify that the labeled dose of the key active ingredient matches the dose used in the research. Take turmeric as an example. The research on turmeric for arthritis used roughly 500 to 1,500 milligrams of curcumin extract, the active compound, combined with a bioavailability enhancer like piperine, or as a phytosomal complex like Meriva or Theracurmin. A bottle that says 950 milligrams of turmeric root powder sounds impressive, but contains essentially zero curcumin in absorbable form. The right product would say something like 500 milligrams of curcumin extract standardized to 95% curcuminoids with 10 milligrams of biopyrine black pepper extract. If the front of the bottle gives you a big number, but the back doesn't tell you what's actually being measured, that's the red flag. The trick to spotting this: for every active ingredient, the label should tell you the form, the amount, and the standardization. Form means which compound: curcumin, gingerols, S-allylcysteine, magnesium glycinate. Amount means the milligram dose. Standardization means the percentage of active compound, like standardized to 5% with analytes for ashwagandha. If any of these three is missing, the product is hiding something. Pattern interrupt. If you're finding this useful, if you want more practical, evidence-based guides like this, subscribe to the channel. I publish 2 videos every week, and the free supplement label checklist for this video, laminatable, wallet card sized, is linked in the description. Take it with you next time you shop. No email required. Red flag number 5, fillers, dyes, and bulking agents you wouldn't eat. Flip to the back and look at the other ingredients or inactive ingredients list. This is what's in the capsule alongside the actual supplement. Some inactive ingredients are necessary, like cellulose for the capsule shell or rice flour as a small filler. Others are unnecessary and worth avoiding. Watch for titanium dioxide, used as a whitener, recently banned in the EU as a food additive due to safety concerns, still allowed in the US. Watch for artificial dyes like red 40, yellow 5, blue 1. These are colors with no nutritional purpose, sometimes linked to mild reactions. Watch for hydrogenated oils, sources of trans fats. Watch for magnesium stearate in large amounts. Small amounts are fine as a flow agent, but if it's the second or third ingredient, the product is mostly filler. Watch for soybean oil or vegetable oil listed prominently in oil-based supplements, cheap omega-6 dominant oils that work against the anti-inflammatory effects you might be looking for. Cleaner brands use minimal inactive ingredients, often listed as just vegetable capsule or cellulose, rice flour, magnesium stearate. If the inactive ingredient list is long and contains things you don't recognize, the product is over-formulated. Red flag number 6, proprietary brand names instead of standardized extracts. Here's a subtle one. Some supplements list their active ingredient as a brand name extract. For example, Ashwa Plus or Neurofocus Complex or Turmeric Max. These are usually made-up brand names with no connection to clinical research. Compare that to the brand names that do have research: KSM 66 and Sensoril for ashwagandha, Meriva and Theracurmin for curcumin, Kyolic for aged garlic extract, Bioperine for piperine. If the label uses an unfamiliar brand name for the extract, search for it online before buying. If the only results that come up are the manufacturer's own marketing pages, you're looking at a private label product without independent research. The studied brand names, the ones I've been mentioning throughout this channel, exist because researchers chose them for trials. The made-up brand names exist because someone wanted a trademark. Red flag number 7, country of origin and supply chain opacity. Where is the supplement actually made? Where do the raw materials come from? Most quality brands disclose this prominently. The labels you should be skeptical of are those that say distributed by a company in the United States without identifying the actual manufacturer or the source of the raw materials. Supplement raw materials from unregulated sources, particularly heavy metal contamination from poorly sourced herbs, are a documented problem. China and India produce the majority of the world's raw supplement ingredients. The good manufacturers from those countries follow strict quality protocols. The bad ones don't, and contaminated material has been found in supplements at major U.S. retailers. The fix is simple. Look for a label that names the manufacturer, the country of manufacture, and ideally provides a phone number or website where you can verify a certificate of analysis. That's a document showing the product was independently tested for purity. Reputable brands will provide a certificate of analysis on request. Brands that won't or that don't respond to inquiries are not worth your money. Pattern interrupt. Quick reminder, the free wallet card checklist that summarizes all 7 red flags is in the description. Print it out, fold it, keep it in your purse or wallet, bring it next time you're in the supplement aisle. 60 seconds with the checklist beats 45 minutes of YouTube research at home after you've already bought the wrong product. Now let me give you the 4 pieces of information that actually matter, what to look for, not just what to avoid. First, the specific active compound and its dose, not the total weight of the herb, the active compound. For turmeric, that's curcumin. For aged garlic, that's S-allylcysteine. For ashwagandha, that's withanolides. For magnesium, that's the elemental magnesium content. For omega-3, that's EPA plus DHA, not total fish oil. Compare the dose to the research dose for that compound. If they match, good sign. Second, the form of the ingredient. Different forms absorb differently. Magnesium oxide absorbs at 4%. Magnesium glycinate at 40%. Same milligram dose, 10 times different effect. Iron sulfate is rougher on the stomach than iron bisglycinate. Vitamin D3 absorbs better than D2. The form on the label matters as much as the dose. Third, third-party certification, USP, NSF, or consumer lab. One of these 3 on the label gives you reasonable confidence the product contains what it claims, in the dose it claims, without contamination. Fourth, manufacturing transparency. Named manufacturer, disclosed country of origin, available certificate of analysis on request. Customer service that responds to inquiries. If a product has all 4 of these, clear active compound at the research dose, the right form, third-party certification, and manufacturing transparency, you're looking at a legitimate product. If it's missing one, proceed with caution. If it's missing 2 or more, walk away. Now let me give you a few specific examples of how to apply this in the supplement aisle. Example 1, buying turmeric for arthritis. You pick up bottle A. It says turmeric curcumin 950 milligrams. On the back, the supplement facts list reads turmeric root powder 950 milligrams. No curcumin extract listed, no standardization percentage. No piperine or absorption enhancer, no USP or NSF mark. Put it back. Now bottle B says curcumin C3 complex 500 milligrams, standardized to 95% curcuminoids with biopurine black pepper extract 5 milligrams. USP verified seal on the front. Manufacturer named on the back. Bottle B is the right choice, even if it's slightly more expensive, because the actual delivered dose of bioavailable curcumin is vastly higher. Example 2, buying magnesium for sleep. Bottle A says magnesium 500 milligrams on the front. The back reveals magnesium oxide, the form, 4% absorbed. That's 20 milligrams elemental magnesium delivered. Bottle B says magnesium glycinate 300 milligrams elemental magnesium, 40% absorbed. That's 120 milligrams delivered. Bottle B delivers 6 times more usable magnesium despite having a smaller number on the front. The number on the front of the bottle is almost never the right comparison. Example 3, buying omega-3. Bottle A says fish oil 1200 milligrams. Sounds impressive. The back lists EPA at 180 milligrams and DHA at 120 milligrams. That's 300 milligrams of usable omega-3 out of 1200 milligrams of total oil. Bottle B says omega-3 fish oil, 1,200 milligrams of EPA and DHA combined. Same total weight on the bottle, but 4 times more actual omega-3. Bottle B is the legitimate product. Pattern interrupt. The pattern across all 3 examples is the same. The front of the bottle uses the biggest possible number to attract your attention. The back of the bottle tells you what's actually delivered. Always read the back first. Always. Let me now address some specific scenarios I get asked about. What about supplements from Costco, Sam's Club, or other warehouse stores? Generally, the major warehouse store house brands, Kirkland Signature in particular, are surprisingly well tested and reasonably priced. Kirkland's vitamin D, fish oil, and several other supplements have been independently verified by Consumer Lab. Costco's volume allows them to demand third-party testing from suppliers. For many basic vitamins and minerals, warehouse brands offer good value. The exceptions are specialty supplements, herbs, adaptogens, complex formulas, where the warehouse offerings are limited. What about supplements ordered online from Amazon? This is more complicated. Amazon has had ongoing problems with counterfeit supplements. Even bottles from reputable brands have been found to contain fake product when sold through Amazon's marketplace by third-party sellers. The fix is to buy directly from Amazon as the seller, not third-party marketplace listings, and ideally buy from brands that have direct authorization from Amazon. Many quality supplement companies sell on their own websites at similar or lower prices and guarantee authenticity. When in doubt, buy from the manufacturer's website directly. What about online discount supplement stores? Vitacost, iHerb, and similar online retailers generally have decent quality control for the major brands they carry. The savings over retail can be significant. Watch for expiration dates on deeply discounted items. Stick with brands that carry USP or NSF certifications. What about supplements from independent health food stores? These vary enormously. The best independent stores employ knowledgeable staff and stock well-tested brands. The worst stock fringe products with extravagant claims. Use the 7 red flags I've taught you regardless of where you're shopping. What about pharmacy chain store brands? Walgreens, CVS, Rite Aid. The major pharmacy store brands often perform reasonably well on independent testing. They're not the worst, not the best. For basic vitamins and minerals, they're acceptable. For specialty supplements, look elsewhere. How do I check if a brand has a certificate of analysis? Visit the manufacturer's website. Look for a quality or testing or certificate of analysis page. Reputable companies post current certificates of analysis publicly. Companies that don't post them often will email one on request. Emailing customer service and asking is a useful test of company transparency. If they refuse, evade, or take more than a week to respond, that tells you something. What if my doctor recommended a specific brand? Some doctors and naturopaths sell or recommend specific brands. This can be appropriate when those brands have strong evidence and the doctor has good reasons, but it can also be problematic if the doctor receives commissions or has financial relationships with the manufacturer. Ask your doctor why this specific brand, what the evidence is, and whether there's financial disclosure. A confident doctor will answer those questions transparently. Let me give you the practical recommendation, the one I'd give a friend at the supplement aisle. First, before you buy anything new, do 30 seconds of research on your phone. Search the active compound and the word research dose. Note the form used in studies and the typical dose range. Now you have a target. Second, in the supplement aisle, pick up the bottle and turn it over. Read the back first. Find the active compound, the form, and the dose. Compare to your research target. If it matches, continue. If it doesn't, put it back. Third, check the inactive ingredients. Short list with recognizable items is good. Long list with chemicals you don't recognize is a warning. Fourth, look for a third-party certification, USP, NSF, or Consumer Lab. If present, that's an additional vote of confidence. If absent but everything else looks good, the product may still be acceptable, but you're taking the manufacturer's word for it. Fifth, look at the manufacturer name and country of origin. Named manufacturer in the US, Canada, UK, EU, Australia, or New Zealand is generally a reasonable baseline. Unnamed manufacturer or distributed by only is a yellow flag. Sixth, scan for the 7 red flags one more time. Proprietary blends, meaningless badges, outrageous claims, buried active ingredient, excessive fillers, made-up brand name extracts, opaque supply chain. If any are present, weigh whether the rest of the product makes up for it. Seventh, compare to 1 or 2 alternatives. The first product you pick up is rarely the best value. Quick comparison shopping in the aisle, especially using the price per active dose, often reveals the real winner. What this skill will do for you over time, it will save you hundreds of dollars per year on unnecessary or ineffective supplements. It will keep you safer from contaminated products. It will let you have more confident conversations with your doctor about what you're taking. And it will free up your supplement budget for the few products that actually have strong evidence behind them. What this skill will not do, it will not turn supplements into medications. Even the best supplement, perfectly chosen, is a modest intervention. It complements proper nutrition, regular movement, adequate sleep, and prescribed medical care. It does not replace any of those things. The most effective approach for most seniors is to take a small number of well-chosen, properly verified supplements, vitamin D, magnesium glycinate, fish oil, perhaps aged garlic or curcumin if relevant, rather than a long list of marginal products. The supplement industry is not your enemy, but it is not your friend either. It is a $20 billion marketplace that profits from confusion. The skill you've built in the last 45 minutes, recognizing the 7 red flags, finding the 4 pieces of real information, and walking past the products that don't measure up, puts you back in control of that aisle. You're now reading supplement labels like a pharmacist would. Use that skill every time you shop. In the next video on this channel, I'm reviewing drug-herb interactions every senior on blood thinners must know. A comprehensive guide to the specific supplements that increase bleeding risk and how to discuss them with your pharmacist. If you haven't subscribed yet, the link to the free wallet card supplement label checklist is in the description, and the next video drops on Friday morning. Thank you for watching. Shop smart, ask questions, and never start anything new without checking with your healthcare team.